Good evening, friends. Meeting again in the session of Materia Medica, and we are discussing since last 2 days the Lycopodium clavatum. A very big remedy, detailed understanding, detailed proving have been done regarding the Lycopodium, and that's why it is a remedy which is useful for n number of aspects, and it is a part and parcel of our day-to-day practice. The Lycopodium is there. Lycopodium is there for even acute conditions as well as for chronic conditions. For both types of disorders, the Lycopodium plays the role. And we have discussed on day 1 and day 2 few cases of Lycopodium, followed by first day the constitution of Lyco, the adult constitution of Lycopodium, at the same time the children, how they are puny because of defective assimilation, and sparse hairs, a baldness, premature old age, frowning, greasy face, with motions of wingspan like of nose and the dilated nostrils, semi-dropsical constitution, all those things we have discussed on day 1, followed by the yesterday the respiratory affections of the Lycopodium, specifically the in the children, obstruction of nose when lying down, basically at the night specifically, with a pneumonitis, long-lasting pneumonitis or chronic pneumonitis, neglected pneumonia. Then we have discussed the GI troubles, which are very specific for the Lycopodium, the throat troubles where it goes from right to left, the diphtheria, and we have compared it with like lachesis and laccan. We have discussed about the GI trouble, the flatulence specifically accumulated in the lower abdomen, better by flatus, but not better by eructation, associated with severe appetite, but few mouthful fills the stomach, and craving for the sweets. There is canine hunger, but patient eats and little bit fulfills his stomach. Along with a typical constipation with severe urging for the stools, but unsatisfactory stools, which are themes which we have discussed. So these are very important things. Along with that, urinary complaints we have discussed. In the urinary complaints, there is specifically the right-sided ureteric or renal cooling, which is characteristic of Lycopodium, and tendency to the gravel formation or stone formation, which is another important thing which we have discussed. So these are things which we have discussed. Now we have to go further. But before that, one case which I want to share, because that it came to my mind, that it was interesting thing, that a pregnant lady who was my patient earlier in regular her regular complaint, and she got pregnant, and she was with the gynecologist for the treatment, and one day she came, and it's the 6 7 months of pregnancy was going on, and she said that, doctor, my gynecologist have checked me many times, and since last one I'm suffering that there is a I get often on the very severe trouble in my abdomen. She has given me deodorant. I won 2 days. I was admitted with the deodorant drip. But question is not with the pains. It is the fetus which is there inside that gives me a lot of thrusts inside the abdomen. And this from this I am suffering. And she said that nothing can be done, and she has given all those things. She asked your doctor that is there in a homeopathic remedy for such a thing, and that is very typical future which I have read with the Lycopodium, which has been mentioned in the Lycopodium by Allen, and that is very specific for the Lycopodium, and that's what I have considered. So there is one symptom. If you open the Lycopodium, there is one symptom, specifically the pregnancy. Fetus appears to be a turning somersaults. Somersaults means kolante ude maran. The 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 person, the mother, is feeling that the thrust is because of that fetus, and which is moving up and on here and there, and that thrust was causing the trouble to her. So I have prescribed the Lycopodium to her, and I said, let's see what happens. There are medicines in homeopathy I have not yet used for this condition. Let us take, it will not cause any damage to you because it is the safest medicine. And she took the dose of lycopodium, 3 doses. I have given moderate potency, 200, and I asked her to meet me after a week. And when she returned after a week, she said, "Yes, doctor, your remedy has worked wonderfully. And now I never feels that." That is big change which has happened after span of nearly about 1 month, because I was suffering a lot for that. See, the lycopodium given to the mother penetrates over there and calm the in fetus over there inside the womb. This is what is the dynamic effect of the lycopodium, and that worked in her case wonderfully. So such many uses are there of the lycopodium. So lycopodium is the remedy which you can think in such types of conditions where you never think that this will cure by the lycopodium, and it cures many a time, because this is so deep acting remedy and penetrating remedy in the human life. So we'll turn towards the next symptoms which are related with the sexual system. We have read up to the urinary complaints. We'll go ahead with the sexual system, the male genitals. And first symptom which is explained over there is the impotence. And this is very specific of the lycopodium. Impotence of young men, specific, underline this, young men, the impotence which is developed with the young men from onanism or sexual excess. Onanism is very much sexual thoughts with doing masturbation, and because of which they develop later on the impotency, or because of lot of sexual excess, ultimately leading to the impotency. That is characteristic of the lycopodium. The penis is small, cold, relaxed. Old men with strong desire but imperfect erection, and that has been given in italics. And this is the symptom which has been told by many patients in my practice. This is very typical with them, that these people, they have a lot of sexual desire. They are little bit ashamed, or they are how to ask the doctor, but I'm suffering from such and such thing, and they ask ultimately. And when they get familiarized with homeopathy, then they ask. And if we give lycopodium to them, it works. So lycopodium is a very specific remedy for the persons who are having, specifically old persons with strong desire but imperfect erection. Impotence, falls asleep during an embrace. These persons are so exhausted that they are, during the act of coition, they get into the sleep. This is another feature which the lycopodium covers. And this was told to me in my early practice by a couple who came to me, and they told, this happens to this fellow every time, many a times this. And we have seen to a very big sexologist from Mumbai, and they have told us that it happens because of exertion and etc. And they told that take a rest in the afternoon, and then you should have contact in night. But nothing is working, it happens to be there. So this is very important thing one should not forget. So I have utilized this remedy on the basis of this specific symptom, and it worked with that individual. So it was nearly about in 1995-94 case was there. I have treated with the lycopodium. There was a question what impotence in diabetes mellitus. Yes, impotence in diabetes mellitus may be this remedy, but most common remedy where the diabetes is increased with a debility, the acid fast is the wonderful remedy for that. So acid fast plays a very vital role in such types of cases. Falls asleep during an embrace, impotency with premature emission, and this is the problem with lot of males. Premature ejaculation, premature dribbling with the semen, and this is a very specific remedy for that. It happens because of either two reasons. There is hesitation, anxiety, hurriedness in those peoples. The lycopodium personalities itself, they are little bit timid, and this reason that creates anxiety. Then they never get early um, strength in them, and later on, because of excessive sexual thoughts, the semen dribbles early. And that's a very common thing which happens with the lycopodium. So see, male sexual system, it has a lot of effects, and all are in day-to-day practice you're going to see in patients. Maximum cases you get this symptom in patients. Then he explained dryness of vagina, now the female genitals. Dryness of vagina, burning in during and after coition. Lysine is another remedy which has been mentioned over there. And this is very common generally in the women who are just above the 40 years of age. They generally suffer from this specifically dryness of vagina, and this is a wonderful remedy to be utilized in a low potency, not in high potency. It should be given in low potency, 30 in repeated doses for a week, and it works. It produces that typical secretions which are necessary for the process of coition. Lysine is a very important remedy, but lysine is completely having opposite mind. This remedy where you can find it out, the lycopodium, the cowcodice, the teameat, the shy, which is the exactly opposite is the lysine. Lysine is absolutely bold. Lysine is absolutely cruel remedy from your materia medica. So two are absolutely opposite. So it is very easy to differentiate between two remedies. The physometra, which I have yesterday told to you that yes, it is the passing the platus from the vagina, and this is very specifically mentioned about the lycopodium, and I have cured such types of cases many a times with the help of lycopodium. Again, the potency here to be utilized is 30, and you have to go ahead with increasing the potency, but it works in 30 only. It produces its result. There is one more feature in case of female genitalia, and that is again a characteristic feature. What is it? Discharge of blood from genitals during every stool. Every time patient goes for passing stools, and there is with the pressure, there is bleeding from the vagina. A typical characteristic. Again, we have to find it out. See, these are very important things which he tries to explain over there. Now it turns towards again inguinal problems generally, specifically in males more commonly. And on day one I have explained a case of inguinal hernia, right inguinal hernia treated with lycopodium. It is this specific remedy in such types of cases. So hernia right-sided has cured many cases, especially in children, and it is the thing that it used to work in children, more commonly in children, because children they are active enough and their muscle strength can regain with the help of lycopodium. In adults, it is quite difficult because muscle becomes rigid in the old age or even in adult age. And that's why the recovery may or may not be possible in adults with the hernia. But if it is in children, there are a lot of chances that children can recover from the hernia with the help of lycopodium. If it is abdominal hernias, umbilical, specifically umbilical hernia, Nux is the very specific remedy. Third important thing, if it is the strangulated hernia, Nux is mentioned over there, but I have never had a chance to treat strangulated hernia. So, but it has been mentioned in the materia media. Then next, that is what is the very important feature, and now you can get such types of cases post-COVID. These cases are more common in day-to-day practice. Pneumonia, neglected or maltreated pneumonia. See, this is very important thing. Neglected pneumonia, which is pneumonia was there and which was neglected, never looked properly and remained persistent for a time. Maltreated, not properly treated even with the allopathy. Base of the right lung is involved especially. It is the base of the right lung. We have discussed about while reading the calcarea cup, upper one third of the lung is involved in calcarea cup. Here it is lower base, lower part of the lung is involved. To hasten the absorption and expectoration, lycopodium plays very vital role. So all neglected pneumonias, with patient comes to you a lot of expectoration and it used to happen continuously and it persists for longer time of duration, never recovers early. And such types of cases, if you give lycopodium, it completely do a resolution. You have learned in inflammation chapter of pathology that the sequelae of acute inflammation is always a resolution. If it never happens, it leads towards the chronic inflammation. If it persists for longer time of duration, this in such types of pneumonia cases, then it becomes a chronic. So acute inflammation or acute pneumonitis can become a chronic and produces a problem over there. So this is very important thing which you can find it out with Lycopodium. Give the Lycopodium and it stimulates the process of resolution and everything vanishes. Whole thing gets absorbed over there. Then cup. How is the cup of Lycopodium? Cup is deep, hollow, even raising mucus in the large quantities affords little relief. And patient goes on cupping and expectorating, and patient is not getting settled. Question arises from where this cum originates. This is the question asked by many patients. Doctor, cup continuously, there is a lot of cup and it comes again and again, but which never gives relief. And this persists for longer time of duration. Lycopodium is a very important remedy because this cup is the product of old neglected pneumonias over there or maltreated pneumonia. Next feature is common, which we have read by reading the Syncona or Digitalis or even Ipecac. The one foot is hot and other is cold. On that day, I have told you that use your back of the hand and touch the head, touch the lower extremities, the hands, and see the temperature. Here you can get such types of feature. In case of children, one cheek is red and hot, other is pale and cold, chamomilla. So why this is the clinical examination and this is the habit which you have to create in order to check the infants. Infants and children, this is too important to find it out. And for that purpose, it is a very, very important feature. One should not forget that is a characteristic of the Lycopodium clavatum. And last symptom which he has mentioned, patient is waking at night feeling hungry, like a sina, like a soranum, and they want to eat something and they again go for the sleep. So the hunger which returns at the midnight and they wakes up and they eats and then they sleeps. Sina and soranum along with the Lycopodium are very important remedies for that. Now the most important part, practical hints given by um, Allen over here in the remedy relationship. The complementary he has mentioned is the iodine. Bad effects of bad effects of onion, bread, wine, spirituous liquors, tobacco smoking, and chewing. Lycopodium along with arsenic album. These are the two remedies which are very specific for such a thing. Very important. Basically for the tobacco chewing and the smoking, along with arsenic, lycopodium is a very important remedy. One must think about it. Follows well after the calcarea, carbovage, lachesis. After sulfur, it has been written, but this is wrong. It is not after sulfur. After sulfur, you have to give the calcarea. After calcarea, you can go for lycopodium. Follows well by sulfur. That is very important. So after calcarea, you can give lyco, but after lycopodium, you can give the sulfur. So sulfur, it has been written over there. It is not a remedy. After like calcarea, lycopodium is the remedy. Is it okay? Lachesis and lycopodium, they are complementary to each other, which is not written over here, but they are complementary to each other. I'm sure. See the remedy relationship. It is there. Lycopodium and lachesis. These are two because these are the close remedies having opposite modalities, opposite sides. And that's why lyco complements with the lachesis and lachesis complements with the lycopodium. Then next part is very important. What he says, it is rarely advisable to begin the treatment of a chronic disease with lipo unless clearly indicated. Why he says like that? It is very, very deep acting polygraph. Don't give a deep acting remedy unless and until it is indicated. If you repeat it for certain time, it creates its own symptoms over there, and that's why, and it never remains for time, certain time, it remains long lasting. 60 days action is mentioned about the lycopodium and it's so deep acting. That's why he mentions over there, unless you are damn sure this is lycopodium, should not give the lycopodium first. What he says, it is better to give first another antisoric and then go for lycopodium. So such a if remedy is wrong and if it starts its producing its medicinal aggravation, it remains for longer time of duration. And for that purpose, this hint is mentioned by the Allen. Lycopodium is a deep-seated, long-acting remedy and should rarely be repeated after improvement begins. What is it? Lycopodium is deep-seated, long-acting remedy should rarely be repeated after improvement. So once you get the person is you have got the action of Lycopodium, stop. Then you should not repeat it too much. Then what it says over there? Aggravation. Nearly all diseases from 4 to 8 p.m. Lycopodium along with Helleborus. From 4 to 9 p.m. it is colosine. MacPhos is mentioned over there, but I could not get that from where it has been collected. But it is in one book I have read, but I cannot recollect from where it has been mentioned. Amelioration is warm foods and drinks from uncovering the head and loosening the garments. That is very intolerance of tight clothing around the waist is of the lycopodium. That is very difficult. In the chest, it is lycasis, or around the neck, it is lycasis, but it is around the waist is lycopodium. And that's why loosening the garments ameliorates the lycopodium. So this is very typical of the lycopodium, which has been mentioned by Allen, and the remedy, which is very, very useful in day-to-day practice. So potencies depends for what purpose you are using. If you are using for pathological cases, better to start with the LM scales. Or sometimes if you feel that 1 or 2 doses are sufficient, you can go with 6 or 30 few doses and wait for the result. But don't go on repeating lycopodium for longer time of duration. Keep it in your mind. Lycopodium is not the remedy to be repeated often. This thought should be born in your mind regarding the lycopodium. So this is what about the all about the lycopodium, which we have discussed in length for 3 lectures consecutively. My question is that those students who are in second year, do you have lachesis in this year? In the second year syllabus, new syllabus, second year batch. If it is there, we can go for lachesis complementary to the lycopodium. And if it is not there, then we can go for the sulfur. So what I don't know exactly, it is not there in front of me. I think legacy is not there for second year. So we'll go directly with the sulfur on Monday and we'll continue with the sulfur because again a big defecting remedy and lot of things are there regarding the sulfur. So we're going to learn sulfur on Monday's session. Till that period, do a revision
Sir,
what the remedies which we have learned up till now. Okay?
sir, sir,
Yeah?
one question is that, sir.
Yes.
Sir, patient after CVA,
Huh?
cardiovascular accident,
Hmm.
patient having pneumonia, hospital acquired pneumonia.
Hmm.
Sir, should we start with, sir, carbamazepine? Here oxygen level is 91.
Patient is whether patient is gasping for the air.
No, sir, today he is in comatose position, sir. Comatose situation.
If he is in comatose situation, carbohydrate
Mm.
is the remedy when patient gasps for air.
Sir.
Patient wants fanning, patient wants air continuously. That is very typical with the carbohydrate patient. If patient
Mm.
has entered into the coma, the
Mm.
you have to find it out remedy which covers the comatose states.
Okay.
It might be opium, it might be helleborus. It depends what type of presentation is there. You have to go.
Lorocerasas, Lorocerasas,
Huh?
Lorocerasas.
Laroche, what I am telling you, you should not
Mm.
fix your prescription before watching the patient.
Mm. Mm.
You
Mm.
observe the patient, find it out
Mm.
what is there, what are the characteristics which you can observe over there, and if you
Mm.
catch, then accordingly you have to find it out a remedy.
Okay, sir.
Don't think remedy on the diagnosis.
Okay, sir.
See, what is, if I have seen, I will share a case that I had
Okay, sir.
my one of close relative who was admitted in ICU in Nasik. It's 5 6 in fact 8 10 10 years back. And I just went over there to meet him because he was in very serious state and he was in comatose state and never came out. Nearly about 8 days after from the coma, and he was just over there in the ICU. So I went over there to meet, and I have seen this picture. This is the way he was lying down over there in the bed. He was slanting down. His mouth was open, and the as if saliva was there a little bit, and he was in comatose state, doesn't have strength, slanting down over there, mouth was wide open. So this is what you have to observe. I took the permission of the physician over there in that hospital, and he said, "Sir, give homeopathy. Why not? Ultimately, after 8 days, if he is not coming out, if your remedy acts and he comes out of the situation, it's well and good, because we can't do. We have given the mannitol, we have given everything, steroid is going on, everything is going on. Still, he is not coming out of that. So give that." And I have given him the muriatic acid. And with muriatic acid, after few doses, he came out of the situation. In fact, after muriatic acid, 2-3 hours after, he got the consciousness over there, and he's still normal. He's doing everything is fine with the patient. So this is what you have to observe when you observe the cases. You should not fix your remedy on the basis of diagnosis. You find it out on what patient present. Same is true when repeated store formation is there. Lycopodium is very important remedy, but there are many remedies. Lycopodium is one of them. There are many remedies you can get. Ultimately, it is a constitutional remedy which you have to find it out for that. So, any other query is there? We can have chat. Otherwise,
Okay, sir. Thank you, sir. But in case of pneumonia, you have to control the pneumonia. Actually, patient is in.
You don't have to control the pneumonia. You have to treat the patient.
Okay, sir. Okay, sir.
Pneumonia is the part of it.
Okay, sir. Okay, sir. Thank you, sir. Thank you, sir.
Okay, thank you being there, everyone. We'll meet again on Monday evening with the sulfur. That's all for today. Thanks a lot. Good night.